There is no doubt that cloves are one of the most potent and aromatic spices, used both for culinary and medicinal purposes. These small dried flower buds are packed with antioxidants, essential oils, and compounds like eugenol that can benefit our overall health and wellness. From spicing up dishes to being a key ingredient in remedies for dental pain, it seems like cloves have a versatile role in both kitchens and traditional medicine cabinets. But did you know that they might not be suitable for everyone? That's right. If you thought cloves were universally beneficial, think again. In this video, we're going to uncover the common side effects of cloves and why you should avoid them if you have specific health issues or while using certain medications. Some of these side effects also occur not as a result of existing health issues or medications, but rather because of the way some individuals use them. So stay with us because by the end of this video, you'll have a clear picture of when to avoid cloves and how to use them wisely to reap their beneficial effects. We will also reveal the results of groundbreaking scientific studies that show how you can maximize the benefits from consuming cloves, as well as how you can use cloves to enhance the efficacy of other beneficial compounds. But first, let's start with conditions where you should avoid cloves. Number 1. Liver health. While cloves are often celebrated for their strong antiseptic and anti-inflammatory properties, they might not be the best option for those with liver conditions. You see, cloves contain a compound called eugenol, which in high doses can be hepatotoxic, meaning it can damage liver cells. This is particularly critical for individuals with existing liver issues, as their ability to metabolize and clear substances is often compromised. Long-term studies on spices like cloves have shown that excessive intake can lead to elevated liver enzymes, indicating stress on liver function or damage. Therefore, if you have liver disease or are at risk of developing liver issues, it's crucial to be cautious with your intake of cloves. If you are unsure, your healthcare provider can help you understand how much eugenol is safe for you to consume, based on your individual needs and the health of your liver. Number 2. Blood clotting disorders. Cloves, and particularly their high eugenol content, can significantly affect blood clotting. Eugenol, a major component of clove oil, is known for its natural blood-thinning properties. This characteristic can be beneficial under certain conditions, but poses risks for individuals with blood clotting disorders. For those who have conditions like hemophilia or who are taking anticoagulant medications such as warfarin, the consumption of cloves could exacerbate their risk of bleeding. Research has shown that eugenol can interfere with the effectiveness of prescription blood thinners, leading to an increased risk of bleeding, particularly in surgical settings or in individuals with a predisposition to bleeding disorders. It's important for anyone using anticoagulant medications or who has a clotting disorder to consult with their healthcare provider to appropriately adjust their diet and medication when considering the inclusion of cloves or clove oil. Number 3. Epilepsy and neurological conditions. Cloves possess strong stimulatory properties, largely due to eugenol, which can significantly impact neurological conditions. For individuals with epilepsy, the high levels of eugenol found in cloves can potentially lower the seizure threshold, making seizures more likely to occur. This effect is due to eugenol's action on the central nervous system, where it can disrupt normal neural activity. Neurological studies have investigated the impact of substances like eugenol on nerve function and seizure activity. These studies suggest that while moderate consumption might not significantly alter neurological function in healthy individuals, in those with epilepsy or other neurological conditions, the stimulatory effects of cloves can exacerbate symptoms. If you have a neurological condition or are sensitive to changes in your neurological state, it's crucial to manage your intake of cloves and discuss their use with your healthcare provider to ensure they do not interfere with your condition or medication regimen. Number 4. Gastrointestinal disorders. Cloves, while known for their antimicrobial and anti-inflammatory properties, can also have irritative effects on the gastrointestinal tract, particularly in individuals with ulcers or acid reflux. The active compound eugenol, which gives cloves their distinct aroma and flavor, can irritate the mucous membranes and exacerbate symptoms of gastrointestinal distress, such as heartburn, nausea, and gastric discomfort. Gastroenterologists often advise those with sensitive stomachs or pre-existing GI conditions to use cloves cautiously in their diets. Clinical observations and dietary studies suggest that excessive consumption of cloves can lead to worsening of symptoms in individuals with gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD. If you are dealing with any of these conditions, it's important to moderate your intake of cloves and possibly avoid them during flare-ups. Always consult with a healthcare provider or a dietitian to tailor your spice consumption to your specific health needs and to mitigate any adverse effects on your digestive health. Number 5. Allergic reactions. Cloves, like many other spices, can trigger allergic reactions in some individuals. These reactions can range from mild symptoms, such as rashes and itching, to more severe responses, including anaphylaxis. The primary compound in cloves, eugenol, is often the culprit behind these reactions, as it can act as an allergen when it comes into contact with the skin or is ingested. Allergy research indicates that spice allergies, though less common than other food allergies, are not rare and can be difficult to diagnose due to the wide range of symptoms and the prevalence of spices in many food products. Studies focusing on cloves have documented cases where individuals experienced dermatological reactions or respiratory issues after exposure to the spice. If you have a history of allergies, particularly to spices, it's important to be cautious with cloves and consider undergoing allergy testing. Management of spice allergies typically involves avoiding the allergen and may require carrying emergency medication, such as epinephrine, in case of severe reactions. Always consult with an allergist to understand the best practices for managing your specific allergies and to discuss potential risks associated with cloves and other spices. Number 6. Surgery. Cloves should be used with caution prior to undergoing surgery due to their significant effects on blood clotting and blood sugar control. The eugenol in cloves not only has blood-thinning properties, which can increase the risk of bleeding during and after surgery, but it can also influence glucose levels, potentially complicating surgical outcomes and recovery. Surgical best practices and patient preparation protocols generally recommend discontinuing the use of any substances that could adversely affect blood clotting or glucose management a certain period before surgery. This typically includes both supplements and natural products like cloves. Patients scheduled for surgery are often advised to stop consuming cloves and clove-containing products at least 2 weeks prior to their procedure to ensure that eugenol does not interfere with anesthesia or post-operative healing processes. It's crucial to discuss all your dietary supplements, including the use of natural spices like cloves, with your healthcare provider during the pre-surgical consultation to ensure a safe surgical experience and optimal recovery. Number 8. Pregnancy and breastfeeding. Cloves should be used cautiously during pregnancy and while breastfeeding due to their potent active ingredients, particularly eugenol, which has been shown to stimulate uterine contractions. This stimulating effect raises concerns about the potential for cloves to induce premature labor or affect fetal development. Obstetrical guidelines generally recommend moderating the intake of potent spices such as cloves during pregnancy. The recommendations are based on the precautionary principle to avoid any substances that might pose even a slight risk to the mother or fetus. While occasional use in culinary amounts typically does not pose a significant risk, medicinal quantities of cloves or clove oil should be avoided. During breastfeeding, the active compounds in cloves can also pass into breast milk and might affect the nursing infant. Therefore, it is advised to limit the use of cloves to ensure that no potentially harmful effects are transferred to the baby. Pregnant and breastfeeding women should discuss the use of spices like cloves with their healthcare provider to understand safe levels of consumption and to ensure both maternal and child health is maintained. Now, remember the scientific studies we mentioned at the beginning of the video. Did you know that you can enhance the medicinal benefits of cloves even further by combining them with the right substances? Well, let's take a look at what these scientific studies have revealed. While cloves are already packed with antioxidants, essential oils, and compounds like eugenol, recent research has illuminated a fascinating discovery, where consuming cloves alongside other beneficial substances can actually boost their efficacy. A recent study reported that cloves added to teas and herbal remedies act as a potency enhancer by amplifying the antimicrobial and anti-inflammatory effects. In the study, people who consumed herbal tea containing cloves experienced enhanced relief from symptoms like sore throat and dental pain more effectively than tea without cloves. So what's the science behind this incredible boost? Well, it all comes down to the synergistic effects of the compounds found in cloves. These compounds are effective at combating pathogens and reducing inflammation, which can be enhanced when combined with other therapeutic herbs and spices. So how can you put this knowledge into practice? Well, try adding ground cloves to your tea, using clove oil in aromatherapy, or incorporating cloves into your recipes for medicinal syrups and pastes. Not only will these clove-enhanced remedies be effective, but they'll also offer your body a significant health boost that can support everything from immune health to dental care. If you want to learn about the numerous benefits of cloves, we have a different video where we discuss that in detail. It's linked in the description. So, what about you? Do you use cloves in your health regimen? Have you experienced any noticeable improvements after incorporating them? How often do you use them? Also, what benefits have you noticed from using cloves? Share with us in the comments section below. If you enjoyed the video, don't forget to like the video, subscribe to the channel, and hit the bell icon so you don't miss out on the next video.